Okay, the last contraindication of the blood gas sampling is if they're on any anticoagulation therapy like heparin or Coumadin. If they're on those, you might not want, it might be a relative contraindication because they might bleed and bleed and bleed and bleed. So you might not want to do it if they're on a high dose of anticoagulants. Then we go to hazards and complications. I always like to know those because you never know when one of those might happen. I have 8 listed here. We have hematoma, which is a bruise, you know what that is. Arterial spasm, air or clotted blood emboli, anaphylaxis from local anesthetic, or introduction of a contagion at a sampling site that could create any infection, so that's why you use alcohol. And some people you might, and doctors you might see use betadine, which is still a disinfectant. So if you don't clean off the site, then you might introduce infection to the patient. A hemorrhage, like I said, if they're on high doses of anticoagulants, they might hemorrhage. Trauma to the vessel, which is you not doing it correctly, and pain, of course. So then we go on to the actual analysis, which is when you run it in the blood gas machine. And it has basically the same indications for that, but the contraindications is what I want you to look at because it's a little bit different than the sampling part because you've actually drawn the sample. So the first contraindication is that it hasn't been properly anticoagulated. There's heparin in your syringe here. There's heparin in there. And if you don't activate it initially, or when you get done, get ready to run your sample, if you don't actually roll it around and activate it, then it'll clot in there. It won't run correctly. So that's what that contraindication means. A specimen containing visible air bubbles. So if you have air bubbles in it, you need to get those out because 1, it could tear up your machine, and 2, it'll alter your patient's blood gas results. Okay? And then you'll have to go back and stick them again, so we don't want to do that. And the third one is a specimen stored in a plastic syringe at room temperature for longer than 30 minutes. So that's why we say that you need to put ice in your bag and before you run it and label it and put it in ice before you run it, and so because that will alter your results too. Okay? So we want to do it the right way first as best as possible. Okay. Now, what we have next is a picture, and I'll show you the colored picture. It may not have copied as well. But what it is, I was going to show you, is you see how the towel is underneath the patient's wrist? Sometimes people have alternate techniques in order to draw blood gases. Sometimes if they just lay it up on a bedside table, you can't feel the artery. Sometimes you have to raise the wrist up. So this might be beneficial. Not everybody uses it, but it might be beneficial to you, okay? Okay. Then the next picture you got in there, I believe, the picture of the arm, okay? The arm shows your radial artery that we palpated in the Allen's test and the ulnar artery. It's just showing you where those arteries are at and how they run together down in the hand because you don't want to stick the ulnar artery. You want to stick the radial. So I was just showing you a picture of exactly where to stick. And you see in the wrist where the bone starts right down there. So if you're too close down to your wrist, you're going to hit bone, okay? So you need to palpate back far enough, but you don't want to get back too far because you'll get into nerves and everything. So that's a nice picture for you to go back to. Okay. Then after we learned how to actually obtain arterial blood gas, we need to learn a little bit on how to interpret the blood gases because you'll have values. So the next handout I have for you are normal ABG values or figures. The first one is pH. So the range on these are just normals, 7.35 to 7.45. And we say that if it's on the low end, if it's below 7.35, it's acidotic. If it's above 7.45, it's alkalotic. Then you have PO2, which is your oxygen content in your blood. It's 80 to 100 is normal, but that depends on age, disease processes, and different things. Your PCO2, or your carbon dioxide, which is part of your ventilatory status that we check, is 35 to 45. And again, if it's on the PCO2, if it's lower than 35, then it's alkalotic. If it's higher than 45, it's acidotic. Then the last one you have is your HCO3, or your bicarb. And it's 22 to 28. Sometimes people say 22 to 26. It's not a very big window. And it's the same it leans the same way as the pH does. So it's acidotic on the low end and alkalotic on the high end. So these are normal, and not everybody will be in these normals, so that's why they give you a normal range, and then hardly anybody's in the normal, so you have to go back and forth. Then the next one is actually a chart I made in order to make you a little bit easier when you first learn to interpret blood gases. On the arrows indicate which way the values go, and then, so for instance, on the first one, the pH if it's low, and the CO2 if it's high, and if your bicarb is normal. Nina, what is your acid base? What does it say right there?
Oh, that's respiratory acid.
Mm-hmm. So you got 4 different conditions that and you can elaborate on it more. I realize that, but that's for another lecture where you can elaborate more advanced into your blood gases. This is just a basic course on how you actually differentiate your pH, CO2, and your bicarb. And then if they're all normal, you put normal, okay? That's how that works. Now, what I'm going to do now is write a sample blood gas on the board, and we'll go over it together and see what y'all think it might be, okay? I write it big so you can see. The pH is 7.28. I'll write them all down, then we'll go over them, okay? CO2 is 85. PO2 is 68. Okay. So looking at your chart that I gave you there, you all can, what is your pH? 7.28. Acid. We go down, right? It's lower than the normal. So put acid. Your CO2 is 85. So is that out of range, right? Is that range? Is that high or low? So that's what?
Acid.
Right? That's acid again. Your PO2 is 68. Is that out of your normal range that I gave you?
Yes.
It is. Okay. So we'll just put it's out of range. So what do we call that when it's lower than normal? They're hypoxic, right? But there's different ranges, and like I said, that's further into blood gases than we want to go today. But we'll just say they're a little bit hypoxic. And then the bicarb is 25. So is that normal?
Mm-hmm.
Okay, that's normal. So I'll put it in there for normal. So looking on your chart, if your pH is acidotic, which is low, your CO2 is up, and your bicarb is normal, then what is it, guys? Respiratory acidosis, right. Good. All right. So from this lecture today, I hope you've discovered how to attain a blood gas and then how to interpret those results somewhat. And later on, we will do a lab check-off, peer check-offs in this, and then you'll actually be doing in clinical sites, okay? So as an assessment tool, what I've done is I've made a short ABG quiz. I know y'all like quizzes. A short ABG quiz that I will assess your learning from today. Does anybody have any questions right now? Good? Okay. I'll hand this out, and y'all can give me this as you leave, okay? Okay, thank you.